This video wraps up Chapter 14 of OEC6. We're going to be talking about allergies and anaphylaxis. Specifically, we want to look at the steps that we use to treat a patient with a severe allergic reaction, and specifically, how to assist a patient with a portable epinephrine autoinjector, or an EpiPen. For the management of allergic reactions, specifically if it is moderate to severe, approaching anaphylaxis, this is a true emergency and we need to immediately correct the ABCD related problems. Remember, they're going to have some airway constriction, so if we can open the airway, if we can move to assisting the patient with the EpiPen, the epinephrine will reverse the effects of the histamine and that bronchoconstriction. We want to move to that. Oxygen will always support a patient that is in this situation because, remember, anaphylaxis is essentially a form of distributive shock. In severe cases, we may need to assist the patient's ventilations with a BVM or even begin CPR. ALS should be notified immediately. Other things that we can do for the patient, remembering that they're going to be suffering from some edema. We might want to remove any jewelry or watches or rings or anything around the airway that just may make them uncomfortable as well. We want to put them in a position of comfort that can be seated and slightly forward. This will assist with their respirations and allow them to use accessory muscles. If they're exhibiting signs of shock, then we'll put them supine, and that should assist them as well. If that allergic reaction is suspected, through your assessment and patient history, determine whether or not they have an EpiPen, an epinephrine autoinjector. Don't use anyone else's. Make sure it has to be prescribed for that patient. Now, that autoinjector contains epinephrine, and what it's going to do is reverse the effects of this allergic reaction, reverse some of the effects of the histamine. So it's going to promote bronchodilation, reverse the bronchoconstriction. It's going to promote vasoconstriction, reverse the vasodilation. Well, think about it. If I start to constrict those pipes, I'm going to reverse the hypotension. I'm going to elevate the blood pressure that right now is starting to crash. So these things are packaged as either single dose or dual dose. I keep saying EpiPen, that's just a brand name that we see here, but there are other ones that we encounter, such as the AuviQ. Now, autoinjectors administer the proper dose, so we know that we have the right patient, we know that we have the right dose and the right med and the right route, and this specific dose will be dependent on the patient's size, so there are adult and pediatric doses. Epi acts fast. In most cases, a single dose will start to relieve those symptoms. Now, severe cases may require additional doses, so those EpiPens can be twin packs. The second dose is indicated if the symptoms haven't resolved within 10 minutes or if there is a reoccurrence. Remember, sometimes 2 doses will be packaged in that autoinjector. Reassessment becomes super key. Every 5 minutes, monitor their breathing, listen to their lung sounds for evidence of that bronchoconstriction or some of the pulmonary edema, leaking of fluid into the alveoli of the lungs, and check their vital signs. We should see especially response to that vasodilation. We hopefully will see a positive response in increasing blood pressure. The patient should be able to breathe more easily and restoring these normal vital signs. All of those things that we saw with the vital signs, the tachycardia and the low blood pressure, are signs of shock. And so diminishing those, reversing those because of administration of their autoinjector is going to be a positive thing. Now, there's a few adverse reactions with Epi as well. Because it is essentially that stimulant, you can see some anxiety or some tremor or a little bit of dizziness and so on. In rare cases, there might be some heart rhythm irregularities. In any case, make sure that you call for ALS and transport early for moderate to severe allergic reaction. Even if their condition has improved using the autoinjector, we need to monitor that. And finally, Because it's an auto injector, it's spring loaded. I've encountered this. People can accidentally get that needle, automatically injecting or poking through their thumb or their finger. We want to transport them to the hospital for a follow-up evaluation because it's a vasoconstrictor, and that much epinephrine into one of their small digits, you can actually constrict the blood vessels so much that it becomes hard on that tissue in that small space, the thumb or the finger, and I don't know, they could potentially actually lose that thumb or finger. Let's look specifically at how to assist a patient with an auto injector. Make sure that the EpiPen is prescribed to them. We want to make sure we've got the right patient. Take the medication out of the protective package. Don't use if it's expired or discolored. Right date is one of the things that we check. Take the safety cap off of the auto injector. Use your dominant hand. If you're right-handed, use your right hand so that you can hold this thing very firmly. Be mindful of your own thumb or finger and don't put that over the end of the auto injector so that you don't put it into your own thumb. The tip of the auto injector is going to go against the patient's outer thigh muscle. This is an IM injection. If possible, wipe the skin with an alcohol wipe. But if we're facing a severe allergic reaction, remember this can be administered through the clothing. When you push the tip against the thigh, the needle is going to deploy. You'll hear a click. The medicine will be injected into the thigh muscle, and what you need to do is make sure that you hold it in place for 10 seconds so the needle doesn't come out of the skin. At that point, you can remove the auto injector, dispose of it in a suitable container, and then massage the injection site for 10 to 20 seconds. Be sure to note the time and the dose when you gave the EpiPen for proper handoff to EMS.